Okay, now we're going to demonstrate the making of the carrot and apple juice. It's fairly straightforward. We're making it for many people here because we're here at the clinic and we've probably got 6-7 patients and their companions. But to make an individual carrot juice, you're going to require 1 Granny Smith apple, and you're going to require probably a pound of carrots, and that should make you an 8-ounce carrot juice. So this is Armando. Armando works here with us. He does our shopping, gets all our produce for us, and then a couple days a week he comes in and he makes some juices. So he's going to demonstrate how to make that juice. But before we do that, we want to show you what goes into the carrot juice before we actually pour it into the glass. We have fresh aloe vera here that comes straight from the Dominican Republic. It's one of the most potent digestive tract healers that you can take in. It comes straight from the Dominican Republic. It's organic, it's harvested, frozen, and sent to us 2 to 3 days after harvest. We put about 1 ounce of this in each of the juices throughout the day at the clinic. What also goes into the juices is this potassium compound powder that's been dissolved in solution. Dr. Gerson came up with 300 different experiments to come up with this final potassium solution. It's a 33% mix of potassium gluconate, monophosphate, and potassium acetate. We dilute 8 ounces in 32 ounces of water, 8 ounces of powder in 32 ounces of water, and then each patient gets teaspoons of this in their juice depending on the prescription for their individual condition. They could get 1, 2, up to 4 teaspoons per juice. So that goes into the juice as well. And then we have Lugol solution. Lugol solution is potassium iodide. This is for the thyroid gland in particular. And potassium iodide is the inorganic form of iodine. Not inorganic as in the sense of that it's not grown organically. It's just the inorganic chemical iodine, which is less toxic than true iodine. Iodine is very toxic to the human body. This you can take in large amounts for months, and it won't be toxic to the body. So our patients get this as well to support thyroid function. So these 3 things go into the juice before it's poured in. And now we're going to go ahead and demonstrate the making of the juice. Again, it's straightforward, and we'll get started. We use 2 kinds of juicers here at the clinic. We use the Norwalk juicer, and we also use something called the Pure Juicer. The people who do the juicing here, they actually prefer the Pure Juicer, but both are great juicers, and either or will work. So as you can see, this is a grater and a press. So the vegetable and the fruit gets pressed after it gets grated up. And the grating up of the fruit and the vegetable, what it does is it breaks open the cell contents of the fruits and the vegetables. It liberates the power of those fruits and vegetables. It's a very, very powerful machine. The prices run anywhere between $2,500 and $2,800 after shipping, whether it's a Pure Juicer or a Norwalk. So you put 1 cup essentially. You don't want to overpack the cloth or it can explode. So you put enough just to fill in this square right here. You can see that square right there. You put it to fill it just enough. With the medications, now it's ready to be drunk by the patient.